Well, thank you, Frank. So I'm going to start from some of the big challenges that I heard and then get a little more specific and kind of talk about what my department is doing and what my agency is doing and what NIEHS is doing in this area related to data sharing. So first, that there's a need for a wide array of data, including personal exposure measurements and geographic data, that's absolutely essential, and frankly, some of that becomes problematic, potentially, as far as getting down in the weeds and identification, that the costs and the effort to reanalyze data are huge, and in fact what I heard pretty loudly is just a strict reanalysis may not be worth the time or the money, and we need to justify spending of public funds for any kind of, and I'm going to, again, I'm not going to, it's not reanalysis, I'd like to see more reproduction, looking at different, and replication. There are potentials to reanalyze data and come up with additional understandings or new understandings because of new technologies that are existing. A point that was made only a couple times that I think should be stressed again, that we need to incorporate the voices of vulnerable communities in these discussions, and not only vulnerable communities. At the very end, I think Hal Zenick brought up the issue about Gen X as opposed to some of us who are baby boomers, where people may have a very, very different attitudes as far as sharing personal information. There was some concern raised about false positive studies, and I brought up the issue of false negative studies, which both can have important public health implications. Concern about a chilling effect on recruitment if people are informed that their data may be made completely available. This may not be as much of a problem in some of the very large, kind of statistically based, almost ecological kinds of epi-studies, but may be extremely important when we're dealing with the smaller studies where we have small cohorts that we recruit and we want to follow. There also is the possibility for able to get down into the weeds and identify data, say, participants, that a lot of this could have a chilling effect on international scientific collaboration. The fact that anything that has federal funding might have to be totally available may in fact make people in other countries not interested in participating. Another issue is and this was brought up again and again, is the adversarial nature of some of the efforts that are ongoing, and is there a need to anticipate possible litigation and bring the issues of how can we potentially avoid an adversarial approach in study design right way at the beginning. And then I think one of Ed Sondik's points was extremely important about that the credibility of the funding agency is extremely important when it comes to an environmental public health agency. I had mentioned the fact that the Department of Health and Human Services is working on new informed consent language. This is obviously then going to be a shared government-wide, but originating from HHS, which will include the potential for broad consent. Right now, I think you can't just tell an IRB that, that you're collecting blood or urine and you'll use it for whatever the heck you think you might want to use it for when you think about it. That isn't going to work, but there may be broad consent with lots of opportunities to go back and reconsent individuals who gave you specimens. That, of course, assumes you can find them, which is a whole other issue that should be dealt with. NIH has lots of data sharing policies and data use agreements, which are required up front. And data sharing plans are often required for grantees, often depending on the size and scope of their work. One thing that really didn't come up related to the reproducibility of data is that NIH is kind of taking this head on right now, and Francis Collins and Larry Tabak had a commentary in Nature last month focusing on the lack of reproducibility of especially preclinical studies, but announcing what NIH is intending to do to address the whole issue. And one is developing a mandatory training module on responsible conduct of research for all NIH-funded trainees, both intramurally and extramurally. that NIH, the institutes and centers, are developing use of checklists to ensure a more systematic evaluation of grant applications. And then there are actually pilots being run to assess the value of, for example, cross-reviewing panels. So you take one reviewer from each panel and have them look at the whole review on another panel ongoing, and also have a specific task of evaluating the scientific premise of the application. In other words, when they're reviewing a grant, the key publications on which an application is based, are these in fact valid or appropriate publications? NIH is also having a major initiative that I think many of you are aware of, related to what we call BD2K, which is Big Data to Knowledge. And the goal of this I think it's over $60 million project, is to make biomedical data findable, accessible, and citable. And 4 centers of excellence are being established for biomedical big data and analysis. Now, to speak about my institute for a moment, our journal, the Environmental Health Perspectives, was a pioneer in open access for scientific journals, which is now being called upon by legislation in the House at this point. Our policy for open access is a decades old, and it predates the policies from PLOS and NIH PubMed requirements, for example. And we're evolving publication policies to deal with data sharing issues, such as all the supplemental materials that are online. And we do, focusing on the issue of reproducibility, require a checklist for when papers are submitted to the journal, to make sure that some of the key informations related to study design are readily presented in the study. NIEHS is currently looking at the scope of all the institute data sets and the tools and the management practices. I talked a little bit, very little, about the NTP systematic review efforts, and again, there's a flyer out there talking about our request for information for development of a language standard for environmental health science, which is open. We're receiving comments until April 11th. In order to deal more effectively with scientific computing and big data, we are in the process of hiring a science information officer. We will have 3 public events, which some of you may be interested in. First, there will be a public webinar on April 3rd, focused predominantly on junior researchers to discuss their concerns about data sharing. On June 13th, we are having a meeting related to lexicons, glossaries, vocabularies, and ontologies. That does not have a good acronym. Okay. And it's development of a language standard for environmental health sciences. And on June 13th, the same day, we are going to be holding a meeting on identifying opportunities for global integration of toxicogenomics databases, which I think was a little talk about toxicogenomics and the need for complete data to be available on those. So that's what I've learned. Thank you.
Thank you. Jerry, welcome.